welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today on the program, we are going to answer the number one Googled medical question in America. I was thinking about this program a couple weeks ago, and I thought to myself, I am going to, maybe I should see what America wants to learn about, and I should then provide those answers. And I should have known, being practicing medicine for 30 years, because this same question is probably the most frequently asked question to doctors as well. That's just a little bit harder to discover the answer to. Anyway, the most Googled medical question in America is, why am I so tired? And if people Google this question that often, it tells me that this must be a common problem. And the truth of the matter is that fatigue, which is a feeling of excessive tiredness with low energy and a strong desire to sleep, that interferes with daily activities. So keep that in mind. I know we all get tired from time to time, is for sure a fact of our lives, but is it interfering with your daily activities on a regular basis? If it is, then you have fatigue for sure. So I was looking up the incidence of fatigue, and I was very impressed to see that the lifetime prevalence of fatigue in a person's life, which means that the chances are that a particular person like you might experience fatigue in your lifetime, is as high as 50%. So this is truly a common problem. Of note, the incidence of fatigue is also going up recently, and I think it speaks to our culture for sure, because a lot of the causes of fatigue, and we're going to talk about that shortly, have to do with our culture. So there are 10 causes of fatigue, at least the way I'm structuring this talk. 10 causes of fatigue. The first 4 are uncommon, but they need to be ruled out. And so if you are fatigued, if you are excessively tired, that's interfering with your day-to-day living, getting your normal activities done, then you should go see the doctor to have these 4 things ruled out. If you've watched this program before, I love stories. I believe in the power of the narrative, which is one of the reasons that I love to write, and I love to read, I love to watch movies. I believe in the narrative. It turns out that information conveyed in a story, and I've mentioned this before, is 10 times more likely to be remembered by a person than just giving them the information just without a story. Just giving them the information. If you weave the information you want into a story, people are 10 times more likely to remember that, and that's because our brain is wired through narratives, and so we understand narratives. Our brain is wired to accept them and to remember them. So I'm going to tell you a story about fatigue. This was many years ago. I was practicing in Castleton, and I saw this guy came in, and just seeing his name on the schedule was unusual because he never wanted to come in. There's a lot of people like that. They hate to go to the doctor. I happen to be one of them. I just hate going to the doctor. I realize I practice medicine for a living, but I personally do not like going to the doctor. And there's a lot of people like me out there. Some people are pathologically not interested in going to the doctor. This guy was kind of one of them. Because when he came in, he was really at wit's end. And he said to me, I said, geez, John, what are you doing here? And he says, Doc, my wife's been wanting me to come in for months, but I says, finally, my boss told me I had to come in or I was going to get fired. And his story is this. He was fatigued. And he was so fatigued that he wasn't having he wasn't being able to play with his kids because he was too exhausted. The lawn hadn't been mowed. He hadn't taken out the garbage, and all these things had been going on for months. But he got fatigued to the point where he was actually falling asleep at the wheel. And he was a delivery guy, and he'd had a couple fender benders with his truck because he simply fell asleep while driving. And his boss said to him, "Listen, I like you. I want to keep you on as an employee, but you've got to get this problem fixed." So he comes in to see me. And because I love happy endings, I'm going to tell you that there's a happy ending to this story, because I was able to diagnose his problem. I was able to treat his problem, and I'm happy to tell you that 20 years later, he's doing great. He's still got the same job, and his kids are well-adjusted people. He's happily married, so it's a happy ending to the story. I'm going to leave you on the hook, though, because I know you want to figure out what was wrong with him. I'm going to tell you, but I want to go through some of these other causes of fatigue first. The first 4 causes of fatigue are uncommon. I'm just going to start off with that. They're uncommon, but they need to be ruled out. So when you go to the doctor, this is one of the things the doctor's going to do. He's going to rule out these first 4 causes of fatigue. The first one is your thyroid. And it's just one of those things when people come into me and they're talking about being tired, they always want to have their thyroid checked. Everybody always thinks that their fatigue is thyroid related. And the truth of the matter is that thyroid disease, from my experience, less than 1 in 100 patients who come in complaining of fatigue have significant thyroid disease. It's an easy thing to test, so we should do it. We absolutely should do it because it's easy to fix as well. I love things that are easy to fix. But it's very rarely the case. I can think of hundreds of circumstances where people come in, they were sure it was their thyroid and it wasn't. So we need to check it. It's a simple blood test. It needs to be ruled out, but it's not high on the list in terms of actually causing fatigue. The second thing is along the same lines, and that's anemia. Anemia is a lower red blood cell count or a lower red blood cell mass. And this is also a cause of fatigue. The thing to keep in mind about anemia is just because you're anemic doesn't mean it's causing your fatigue. I see people all the time in the office who are anemic and they don't complain of fatigue. You have to be significantly anemic in order for it to be causing your fatigue. A little story, one of my favorites from back when I was practicing in Syracuse, New York. This guy comes in and with his wife, I'll never forget it. They're sitting there in the office and they're telling me about how this guy is incredibly fatigued. And he was like 65, somewhere in that range. And I couldn't believe how pale he was. And his wife was pale also, but he was a real, true pale. And I asked him, I said, have you ever been anemic before? He says, oh, no, I've never been anemic, but he hadn't been to the doctor in a while. And we checked his blood count, and he had a hemoglobin of 1. Now, your normal hemoglobin is about 15. This guy had 1/15 of the red cell mass that he was supposed to have. And I am still amazed 30 years later that this man was able to function. He couldn't do much, but he was still living his life with 1/15 of his red cells running around his bloodstream. It goes to show you that if you are otherwise healthy, with healthy kidneys, heart, liver, lungs, those healthy organs can compensate for something when there's a problem like that. His heart rate was 150, so his heart was beating to circulate those few red blood cells around and around and around so that he could get oxygen to his tissues. But again, he was severely compromised. But it took him down to a red cell mass of 1 gram of hemoglobin before he came in to see me. When people come in, they're slightly anemic, maybe a hemoglobin of 12 or 13. That's almost never the cause of their fatigue. But again, significant anemia needs to be ruled out. Number 3, a medical cause of your fatigue. Now, a lot of people, when they come to me, they want to make sure they don't have a medical cause of their tiredness, and that's an excellent idea. Some of these, just for you to realize what they are, is hyperglycemia or new onset of diabetes, congestive heart failure, kidney or liver disease, infections such as urinary tract infection, mononucleosis, TB. There's a lot of candidates here. Rheumatoid or arthritis can be another one, any kind of inflammatory arthropathy. But the thing to keep in mind about these is that these causes of fatigue always have other symptoms associated with them. For instance, I had a guy one time, he came in and he was tremendously fatigued. He kind of couldn't function with his life. He wasn't able to go to work, couldn't do anything around the house. And again, it took him months to come in. But anyway, he comes in and I checked the blood sugar in the office and it was 800. And the reason I checked the blood sugar is because he was also complaining of peeing every hour and being tremendously thirsty. So that's an example about how these medical causes of fatigue are always associated with other symptoms. For instance, I had a guy that came in complaining of fatigue from congestive heart failure. But when you questioned him, he couldn't sleep lying down, he was short of breath, his legs were swollen. So there's almost always significant amount of other symptoms when people have a medical cause of fatigue. Again, these need to be ruled out. And when people come in to me and complaining of fatigue, I order what I call the fatigue panel. It's a blood count, so we're looking for, again, anemia or lowered red blood cell mass. I look at a sedimentation rate, which is a measure of system-wide inflammation, trying to make sure somebody doesn't have an inflammatory problem. I measure their chemistry panel, which looks at their sugars, liver and kidney disease, as well as electrolytes. They may have an electrolyte problem like a sodium or a potassium issue that's causing the problems. And I look at a urine, as well as obviously the thyroid that we discussed earlier. So that's my fatigue panel. And I will be honest with you, when people come in complaining of fatigue, 99 cases out of 100, it's completely normal. Simply, these are less common causes of fatigue than causes 5 through 10 that we're going to discuss shortly. The last thing that needs to be ruled out is over-medication. Another great story about over-medication. I saw this guy in the grocery store one time, and he goes, "Geez, Doc, I got this buddy of mine. He's seeing this other doctor, and he really wanted to come see you. And anyway, he's just feeling horrible. And so I'm an easy mark. My secretaries hate it when I go out in public, which is all the time because people ask me questions, and I'm always letting them in. And even when my practice is full." But anyway, he comes to see me. And anyway, he's on 5 medications for his blood pressure. And his blood pressure in the office is still high. And I asked him, I said, "Do you check your blood pressures at home?" He says, "No." He says, "But Doc, I gotta be honest with you, I'm exhausted, I can't move. And it gets worse and worse every time the doctor adds a medication." So I gave him a blood pressure cuff to go home with. He's checking his blood pressures at home. And when he sends his blood pressures back to me in a couple of days, his blood pressures are basically incompatible with life. They are so low, I can't imagine the guy could even move. So what happened was I took one medication away after the next, and when he got down to about 2 medications, he was feeling fine. And his blood pressure on those 2 medications was also in the normal range at home. It turns out that when he comes to the office, he gets a little bit, white coatish, and his blood pressure goes up. But when you measure his blood pressure at home, it was fine. So what had happened was the doctor kept on adding blood pressure medications based on the reading in the office, to the point where the guy, when he goes home, is on 5 medications, and it lowered his blood pressure at one point to like 60/20. For a full-grown man, that's just, I'm amazed the guy was able to move, frankly. It's not just blood pressure medications that can do that. More commonly would be psychotropic medications, which are medications that are active on the brain, such as antidepressants, anti-anxiety medications, sedatives. Also, seizure medications are very common culprits for this, as well as, I think I mentioned pain medication as well. So over-medication needs to be ruled out as well. I have had patients be put on medications that don't normally cause fatigue, but they just happen to cause fatigue in that patient. And as a doctor, you always got to be sensitive to that. This patient may just be having a reaction to that. I put a patient one time on a cholesterol medication, which they don't really cause fatigue. Anyway, he just had terrible fatigue, and when he stopped the medication, it went away. When we resumed it, it came back. So in this case, it was just happened to be an idiosyncratic reaction for this particular medication with this guy. The point is that even any medication, even if it's not notoriously a notorious cause of fatigue, can cause fatigue in a particular patient. Okay, so now the 6 causes rather, causes 5 through 10, that's 6, Peter, that commonly cause people to be fatigued. And the first one is occult depression. I say occult depression, and what I mean by is depression that isn't really causing sadness or the blues. And it's very, very common that people actually who are depressed don't complain of depression. They don't come in and say, "Hey, Doc, I'm depressed." They don't say that. They say other things. They say they're tired. They say they're not sleeping well. They say their appetite's poor. They say their focus is bad. The most common cause of depression is actually anhedonia, which means that a patient is not taking pleasure in life. And I remember I had a guy in my practice, and his wife was worried about him. And she goes, Doc, it's hunting season, and he hasn't even taken his rifle out. And here's a guy who has looked forward to November every year for the past 50 years, and hunting season comes, and he just doesn't even care if it's here. I'm like, that's a classic anhedonia. That guy's depressed until proven otherwise. But anyway, as I mentioned, a common cause of fatigue is depression. And people who are depressed often they just don't realize it. They're thinking other things. They're thinking they've got a medical problem. They think they've got some type of hormonal imbalance or some kind of esoteric problem like that. What they really have is depression, anxiety. These are very common causes of fatigue. So if you are listening to this program or watching it and you're tired, think about it. Is it possible that you've got an occult depression? Because this can be treated. You can be, this is a fixable issue. The next problem is going to be bad diet. And this is another common cause of fatigue. There's 3 ways diet can cause fatigue. Number 1 would just be, starvation or malnutrition to begin with. And I think those are fairly obvious, and people know they're starving. I think most people would know if they've got malnutrition. But here's a subtle one, and that is a carbohydrate-rich diet. Those of you who watch this program a lot will know that I'm always railing against carbohydrates, and no pasta company is ever going to advertise on this show. But the truth of the matter is that diets high in carbohydrate are probably one of the most common causes of fatigue that I see in my practice. How does it work? Well, it's very simple. Your body has a limit. Your body, which is, by the way, as I mentioned before, is designed to get most of its calories from protein. But when people eat high carbohydrate loads, their blood sugar goes up. Following that, their insulin level goes up. The insulin level causes their sugar level to crash, and they actually feel very fatigued. Not only that, but when this happens again and again and again, the constant crashing of your sugar levels actually affects your serotonin levels, which then can cause problems with your mood, problems with your fatigue that are ongoing even when you fix your sugar level. So the point I'm trying to make is you really need to be careful of your diet. Good diets are associated with low levels of fatigue, and you should be thinking about your diet all the time. The standard American diet is not working. The standard American diet, obviously the acronym is SAD, but the standard American diet is to eat as much of whatever food at any time you want. In other words, you just eat whenever the heck you want to. You don't think about what you're eating. You don't think about how much you're eating. And that is what more Americans do than any other diet. We should be thinking about when we eat. We should be thinking about how much we eat. We should be thinking about what we eat. And as I've said many times, if you want to feel better, less fatigue, you're going to lose weight by restricting your carbohydrates and exercising. Speaking of exercise, another common cause of fatigue is just lack of activity. It turns out that when you don't do much, you're fatigued. I explain this to patients by telling them that we are designed to move. We should be in motion. We are, going back to the paleontological roots of medicine, people were on the move. They didn't sit in one place. They were chronically moving. Tribes of hunter-gatherers literally moved all the time. That's how we're designed. That's what we're supposed to do. When you just sit around all the time, you get fatigued. Lack of activity, a very easy way to fix it. Along with that is being overweight. Obviously, it's associated with lack of activity and poor diet, so I thought I'd mention it here. Think of it this way. You would never put a 4-cylinder engine into a Cadillac SUV. You've got a huge Cadillac SUV, it's got a big 8-cylinder engine or a Hemi. You would not put a little 4-cylinder engine in that because it would be underpowered. And that's what happens to us. If you're designed to be 160 pounds and your liver, kidneys, lungs, and heart are designed to carry a 160-pound person, think about what happens when you weigh 50% more. You weigh another 80 pounds, you weigh 240. And if you think this is uncommon, it isn't. It's very common. And these folks come in and complaining of fatigue all the time. They're carrying an extra 50% of body weight. That's a huge strain on all their organs, not to mention their musculoskeletal system. We'll talk about that in a different week. So losing weight actually helps your fatigue. The next one is stress. I mentioned before, I talked about the cultural causes of fatigue. We live in a very stressed out society. It seems to me that every year we get more stressed out as opposed to less. It turns out that when you are stressed, it raises your catecholamine levels and your cortisol levels. And when those things then ultimately go down, because we have a limited supply of catecholamines, a limited supply of cortisol, then all of a sudden you're spent, you're exhausted. And when this happens again and again, you lower your levels of catecholamines and cortisol that you have available to you, and you're chronically fatigued. So constant stress is another really common cause of anxiety. Far, far more common than thyroid. Far more common than hyperglycemia. Far more common than anemia. These are the nuts and bolts of fatigue. These issues I'm talking about now. I want you to go to the doctor and get those first 4 causes ruled out. But when they are ruled out, you want to then concentrate on what we're talking about now. If you want to feel better, and we both want you to feel better. I want you to feel better. When you're my patient, I want you to feel better because when you feel better, you complain less. It's less work for me. Think of it that way. Doctor wants you to feel better because number one, I'm an empathetic guy. I want you to feel better, but I also want when you feel better, you call me less. But these are the things that you need to work on. Okay, so we got one last cause of fatigue, and it's by far the most common, and that is not getting enough restful sleep. So let me reiterate that, not enough restful sleep. The first part of that equation is just too little sleep. I had a kid come in, and his mom was very, very concerned about him because all of a sudden he was extremely fatigued, couldn't get up to go to school in the morning. It was a constant war all the time. And of course, she wanted his thyroid checked, she wanted his blood count checked, all these things. So we did everything. We ruled out all those things. The fatigue panel, as I mentioned before, completely normal. And so I asked the mom the mom took a call, and she goes out of the room. And I said to the kid, because I had asked him before about sleep, and he said, I get a lot of sleep. I go to bed at 11, and I get up at 7. Anyway, I said to him, your mom's out of the room. Tell me, you can't be going to bed at 11. He goes, no. He goes, I just got Call of Duty, and me and my buddies play on the internet. We start at 11 or 10 o'clock, 11, and we played till like 3 in the morning. So here was a kid that got a new video game, and he's gaming with his buddies with one of those headsets, and you know how it goes. He was up till 3, and you can't survive on 4 hours of sleep every night. You can do it once in a while. Trust me, I was a resident physician for a while, and it wears on you. You can go buy a couple of nights, but after a while, you're tired. And the answer is you need more sleep. The second cause of sleep issues is just insomnia. People that they go to bed early, but they just can't sleep. I'm going to talk less about this because we are going to have up in the program a certified sleep expert coming to us, and I'm going to leave those questions to the certified sleep expert. The last answer is sleep apnea. Now, a lot of us have kind of heard of sleep apnea, but basically sleep apnea is people who stop breathing when they're asleep. When they stop breathing, their oxygen levels go down. When their oxygen level goes down, their brain tells them to wake up. And as a consequence of that, every time they go into the more restful phases of sleep, when they're more relaxed, that's when they stop breathing. Their body wakes them up out of it and kicks them back into one of the lower stages of sleep, stages 1 or 2. Now, you're unconscious during stages 1 and 2 sleep, but you're not getting the rest that you need. So although you may be unconscious for 8 hours, you're not getting the adequate rest that you need. You're not getting stages 3 and 4 sleep like you should. And what's difficult to diagnose of these people is that in their opinions, they're sleeping all night, but they're waking up not rested. And sleep apnea is a very, very common problem. It tends to be associated with people who are overweight or obese. And as our problem with being overweight and obese continues to grow in this country, we have more sleep apnea. So it turns out that the guy I told you about at the beginning of the program, he had sleep apnea. When I sent him for a sleep test, he had an AHI of 70. Now, you don't know what an AHI is, but I'm going to explain it to you. It's an apnea-hypopnea index. It means the number of times that this man is stopping breathing in 1 hour. And he had an index of 70. And since there's only 60 minutes in an hour, you can tell that more than once a minute, he stopped breathing. So he was getting almost no restful sleep at all. His stage 3 and 4 sleep was essentially 0. It's amazing to me, and he was only in his late 20s or early 30s at this point in time. It's amazing to me how much people can compensate just from their youth, how they can deal with that. But ultimately, it got to him, and we put him on CPAP. The continuous positive airway pressure kept his airway open. He slept all night, had restful sleep, and he was fine, and he continues to do fine 20 years later. So that's the happy ending I was promising you. And I want to spend our last 2 minutes here talking about how to fix these issues. And I've kind of alluded to them to earlier, how to fix them. So if you are fatigued, the first thing you need to do is go see your healthcare practitioner, and you need to get those underlying causes of anemia ruled out. As I mentioned before, it's very unlikely that one of those is actually causing your fatigue, but you need to have them ruled out. Again, get the thyroid checked, get the blood count checked, make sure you're not diabetic, make sure you're not over-medicated, make sure you don't have liver or kidney disease. Again, a lot of those problems, the more serious ones, come with other clues. But you do need to get those things ruled out. Once that happens, now you go on to the section of fatigue that you can fix, that you can take care of. I always tell people, start with your diet. You are what you eat. I want you to switch to a low carbohydrate, high protein diet. And it's amazing to me how that alone and the weight loss that it leads to will cause your fatigue. People tell me all the time. I had a guy one time, he was constantly complaining of fatigue. He went on a diet for his daughter's wedding. He lost 50 pounds. And do you know something? He came into me and he couldn't stop talking about how great he felt. Just the diet change and the weight loss, and he felt like $1 million. Alcohol and caffeine are not good for people who have fatigue. So if you're fatigued, the first thing you should do is cut way back on both alcohol and caffeine. They're both stimulants. They both cause sleeping issues. And it's amazing to me how simply cutting back on alcohol and caffeine can help people out a lot. Turns out that a lot of people who are fatigued, they use caffeine as a crutch. They simply can't get by without it. But when they start having too much, it ends up becoming worsening the problem. Exercise, I've talked forever about exercise. I'll talk again about it briefly. If you want to feel better, be less fatigued, start exercising. Start with a short walk every day and build up from there. The last thing, in dealing with anxiety and stress, yoga, mindfulness, meditation. Hey, thanks again. Really appreciate you tuning in. Thanks for your attention and participation. Cheers.